Hi guys, Brooke Douglas, pediatric nurse practitioner. Today we're going to talk about heat exhaustion and heat stroke in children. So heat exhaustion is a condition that happens when your child's body overheats due to prolonged exposure to high temperatures or physical activity in hot weather. Recognizing these signs is really important so that you can help them before they develop into heat stroke, which is actually a medical emergency. So the first symptom to watch out for is excessive sweating. If they're profusely sweating even when they're not performing any physical activity, that's one sign. Fatigue and weakness, they may appear really tired, weak, or lethargic and just be have really low energy levels. Their skin can be pale or flushed, so it may be lighter than normal or it may be red and flushed due to the dilation of blood vessels. They can become dizzy or lightheaded, so they might feel a little bit woozy and be a little bit unsteady on their feet and with their movements. They can have a headache. This can be persistent or it can be a throbbing headache. They can also become nauseous and even have some vomiting. Their heart rate tends to increase, so if they start having a rapid heart rate, as the body's trying to cool down, it will increase the heart rate. They can get muscle cramps, and these cramps or spasms can happen in the arms, legs, and even the abdomen. Their skin often is cool and moist. Even though they're sweating, their skin may feel cool to the touch or even a little bit clammy. And they usually have increased excessive thirst, so they become extremely thirsty and just want to continue to drink more and more. It's really important to recognize these symptoms early so that you can help intervene when you need to avoid them developing into heat stroke. So some ways for you to help them out when this happens is to move them to a cool shaded area, provide them some cool fluids, either water or maybe an electrolyte drink like Gatorade, Pedialyte, things like that. Also, you can use a cool rag or a cool cloth on their forehead and on their body to try to bring their body temperature down, and then encourage them to rest. You don't want them to go right back up to their activities until they've completely improved. If they're not getting better with that and they do develop into heat stroke, these are the symptoms of heat stroke. They can faint or lose consciousness or pass out. They could have a severe headache that doesn't improve with those measures we talked about. They can become confused or disoriented. Their breathing becomes really rapid and fast as well. If their body temperature is 103 degrees or higher, 103, not 100.3, but 103 or higher, or if they're having seizures. So if they have any of those, then they have developed into heat stroke, which is actually a medical emergency, and you would need to take them to the ER, call 911 if they're not getting any better. If you have any questions about this, you can always book an appointment or you can call me. The business number is 719-569-5989, or feel free to reach out if you have any other questions or concerns. Thanks. Bye-bye.